The behavioral health initiative, which I have been involved with and our organization has been involved with from the very beginning, as again a small organization, we were the lead agency for the ADHD exploratory initial project. And what that did again was give us the opportunity to bring together all of the behavioral health organizations and participate in figuring out what it was that we needed to be looking at. And this, I think, laid the foundation for this idea that unless we work in a system on an ongoing basis, no one organization, no matter how small or big, is going to make this happen. And so that led us to participate in the Behavioral Health Initiative, which was a huge need for us because I was painfully aware of the need for outcomes, and we weren't doing, with the exception of DSRIP, all of the pre and post testing and evaluations, assessments, screenings that we could and that we knew existed. It's because it's a training issue and it's a timing issue. And so the PPS has helped us to structure what we knew we needed in a way that we could never have done on our own. And I think this is true for the larger organizations as well, because the larger your system, the more training you need, the more coordination you need. So I don't think it's unique to a small organization. But we have fewer resources, so it becomes very important to us to have that scaffolding which BPHC has provided, where we are not only given the tools to learn how to make sure that we're doing it in a way that is going to be deemed, credible, because all of these things have certain validity and generalizability, and you have to do it in a particular way. You can't just give people a screening and say, okay, everybody's going to get the PQH9, and if the staff don't know how to do it, if there's nobody following up and tracking it, if there's nobody even just saying, hey, how many did you do? Because we all have so much to do. And so the accountability that BPHC has provided for my leadership is really critical.